If the sign on your heart says welcome, the love will come pouring in from everywhere. A person with zeal and interest towards the excellence of our nursing profession, guiding us throughout the phase of planning and everything. I request Dr. Lata Venkatesan, Professor and Principal, College of Nursing, AIIMS, to welcome the gathering.
Respected and honorable chief guest of the day, Professor Dr. Guleria, the Director of AIIMS New Delhi, Professor A.K. Kevrari, the Head of Pediatric Department New Delhi AIIMS and the Chairperson of said facility and the organizing chairperson of this wonderful program on pediatric nursing emergency. And the guest of honor of today, Dr. Nirupa Madan, Additional Medical Superintendent of Trauma Center, Mrs. Kamlesh Chandeliya, the Chief Nursing Officer of AIIMS in absentia, dignitaries of the dais, distinguished guests, resource persons, facilitators, dear participants, a very good afternoon to all of you. On behalf of the Department of Pediatric Medicine, AIIMS Hospital and College of Nursing, it is my pleasure to welcome all of you for the inauguration of training of 300 nurses in pediatric nursing emergency preparedness over a period of 5 weeks. The nurses of AIIMS have transformed themselves in meeting the challenges of COVID during the last 2 waves, and their commendable contributions to COVID patient care will ever be remembered in the history of AIIMS New Delhi. Nothing can stop the nurses of AIIMS who are on the mission of taking away the COVID. Yes, they are gearing up themselves to face the challenges of next wave. And in view of empowering them to face the challenges of next wave, we have planned to train a group of 300 nurses with pediatric emergency nursing skills. And this program is planned with self-learning modules, videos to watch, and practice of pediatric nursing procedures in the simulation lab, followed by 1:1 preceptor-guided practice in the pediatric clinical areas, including neonatal ICUs. Identified clusters of pediatric medical faculty and nursing faculty, nursing educators from the hospital, and the clinical nursing officers who are involved in the direct care of pediatric patients are persons. Training of 300 nurses is planned to be done in groups of 30 nurses in each. The effectiveness of this program will be evaluated through pre and post tests, assessing the nurses' knowledge, skills, and self-reported as well as preceptor-reported level of confidence in performing the pediatric emergency nursing procedure. We are thankful to Dr. Guleria, the Director of AIIMS, for mobilizing every possible resources and support to help nurses to conquer the battle of COVID. The entire country has witnessed and benefited his leadership during this unanticipated crisis. We welcome him to address the nurses, which will really motivate them to remain committed and go a long way. And we extend our heartiest welcome to you, sir, consenting to address the nurses. The conceptualization and execution of the pediatric nursing emergency preparedness program has become a reality just because of Dr. Ashok Devrari, the head of the Department of Pediatrics and the chairperson of said facility, who was guiding every step of this program. He gave resource persons, videos, self-learning material, and so much of indirect help and guidance to organize this program effectively. Our special and sincere welcome to you. The need for the program came from Dr. Nirupa Madan, who is the pillar of strength to AIIMS. And she was keen in empowering nurses all the time from the beginning, not only during COVID, even during other unforeseen situations. We welcome you, dear. Behind the successful contribution of nurses of AIIMS is the Chief Nursing Officer, Ms. Kamlesh Chandeliya. My bouquet of welcome to her in absentia. We also welcome the nursing superintendents, assistant nursing superintendents, deputy nursing superintendents from trauma centers as well as students, nurse educators, and experienced clinical nurses from Department of Pediatrics and Specialty, and a sincere welcome to all the resource persons. I extend my warm welcome to dear participants who are the key stakeholders of the entire program and who is going to manage in the forefront the upcoming challenges. So once again, I welcome all of you for this wonderful program and get benefited. Give us the feedback so that we can improve further in the program. Thank you very much. Now I request Professor Ashok Devrani to unfold the theme of the program.
So, good afternoon to all of you. My special thanks to Director Sir for agreeing to come over to inaugurate this important training program, which is skill-based for the nurses. And we need to prepare, especially for taking care of children, in case there is surge of cases which happen over next few months. So we are not sure whether that will happen or not, but it is always better to be well prepared. And I'm so happy that Madam Lata took this initiative that she will work towards empowering 300 staff nurses who have taken care of COVID patients during wave 1 and wave 2 at trauma care center to build up their skills so that they are able to take care of children who may get admitted in COVID wards. Children require special attention. Often they will require one of the parents to stay with them, and their needs are a little bit different as compared to the adults and geriatric patients. So for that, it is very important that you should be exposed to how to take care of children. In addition, the equipment and the supplies and medications which are going to be used are going to be a little bit different as compared to how it is used in adults. So it is important all those skills and competencies must be built among all the staff nurses who are working at trauma center, because you may be posted in a ward where children are going to be there. How do you take care of that child? How do you give preparation for antibiotics? How do you use an infusion pump for that child so that no errors happen and we are able to communicate well with the families? So I am so happy that whatever we are going to build up in the form of modules, and if they turn up better and better with the feedback of all the teachers and participants, Madam Lata, she is heading a group of nurses who are going to make modules for the entire country. So I'm very sure we will be able to disseminate that all over the country in times to come. So once again, my I welcome all of you. You are the first batch, and next 8 batches will come, as Madam said, over next 5 weeks. All the best to you, and enjoy the teaching learning. Interact with the teachers so that you learn maximum about how to take care of kids in case they are admitted during COVID surge. Thank you.
Thank you, sir. A great leader and a dynamic person whose very presence marks the importance of interest vested upon by him on the excellence of patient care. Sir, in spite of his busy schedule, has consented to be in person for this inaugural session. Welcome you, sir, Professor Dr. Randeep Guleria, Director AIIMS, to address the gathering.
Thank you very much. Good afternoon. Professor A.K. Durari, Professor and Head Department of Pediatrics. Dr. Lata Venkatesan, Principal, Professor cum Principal, College of Nursing in New Delhi. Dr. Madan, Additional Medical Student, Trauma Center. Sandesh Chanderia, who is online or has sent a recording message. Dr. Poonam Joshi, my faculty colleagues, both from Department of Pediatrics and from the College of Nursing. nurse educators, other resource persons, the nursing officers who are part of this program, ladies and gentlemen. At the onset, let me really congratulate both the Department of Pediatrics, led by Dr. Durari, and the College of Nursing, led by Dr. Lata Venkateshan, for this very good initiative in starting this pediatric nursing emergency preparedness program for COVID-19. COVID has actually thrown a lot of challenges to us in the last 18 months. And the All India Institute of Medical Sciences, New Delhi, has been at the forefront in meeting these challenges. From the very onset, we really worked hard to really see how we can not only provide quality care to patients who come with COVID-19, but really be at the forefront of education, research for the entire country. And many webinars, many sessions, Centers of Excellence programs, EICUs, run rounds, and other activities have been done at the All India Institute of Medical Sciences to really help in fighting this pandemic. You have successfully managed to do things, converting our trauma center into a COVID hospital, NCI graduate, and we've tried to be ahead of the sort of pandemic in many ways. When we converted the trauma center into a COVID hospital, many people, including senior faculty and some politicians, told me, "Why have you done this? This is going to be just a mild flu, and you don't need to really take such drastic measures." But I think it was a good step that we took, and we were able to manage close to 900 patients that were admitted at a given point in time, both in the first and second. And as we move forward, I think this initiative of getting prepared as far as pediatric age group is concerned is very, very important. As Dr. Durai mentioned, why are we now talking of children and why were we not talking of children in the first or second wave? We were still talking of children in the first and second wave. But this time there is a concern that children may be more affected. We don't have enough data to support that. The feeling is that as more and more adults get vaccinated and children get left behind, and as schools and colleges open, there may be an increase in number of children who may get the infection, and many of them may have severe infection. Therefore, it's important for everyone, doctors, nursing officers, all other healthcare professionals, to be properly trained in how to manage these children. Children are different to manage. You have different age groups. You may have neonatal group, you may have younger children, and you may have relatively older children. So the challenges that they pose in managing them are totally different from what you have in adults. You can't really start saying that children are little adults and we use the same practice. You have to have different practice. What is also very important is that to really train the nursing officers, we've adopted a new and unique method where it's a holistic training. It's not just didactic lectures that you say that we'll have a course for emergency preparedness program. 10 faculty will come, they will take the lecture, and then that's it. You will learn how to really manage children as far as COVID-19 is concerned. This is a skill-based and a holistic development where technology is used a lot. Whether it be looking at your skills, whether it be trying to develop confidence, and then looking at one-to-one interaction with doctors at a real-life situation. And I think this is the way forward. So modules like this will become standard of teaching as we go ahead, even post-COVID, in adopting new ways of teaching students, where we look at technology, where we look at being innovative, and where learning becomes more of a fun and something that you learn rather than just mugging up things from books. So I think this is something that we have to inculcate in all our programs, whether it be the College of Nursing, undergraduate training, or postgraduate training. And as we are seeing what the pandemic has taught us, learning is a lifelong process. Learning is both for the students and the teachers. Sometimes I feel as a teacher that I learn more by taking classes than the students learn. I will read up the entire topic, do a literature search, prepare slides. That itself is a huge learning exercise, which keeps you updated and you learn more than what you talk to your students. It's something that we have to accept that we will continue to learn. The lessons that we've learned from this pandemic are something that we need to follow in the coming years. One of them is how to innovate in teaching. And because this is a module where I think all of you should give us feedback. How can we improve it? What are its lacunae? And then, as was mentioned, this can become something that can be rolled out at a national level. So how can we have good pediatric training for nursing officers across the country? This could be like a pilot project, which could subsequently be refined and become something that AIIMS can offer at a national level. And once this is successful, one can look at various other similar type of projects, making them into modules which are useful. So once again, let me really just take this opportunity to thank the Department of Pediatrics, College of Nursing, and all the source persons who have volunteered and come forward to help make these modules to be part of this overall exercise in making education innovative. So thank you for this process, and I wish you all the best. Thank you very much.
Thank you, sir, for your inspiring words. Now I request Dr. Nirupam Madan, Additional Medical Superintendent, Trauma Center, to say.
Good afternoon to everyone on the dais and friends and colleagues, and especially my nurses from the trauma center. I think it was just around 2 weeks ago that I requested Dr. Tiwari to roll out some kind of an orientation and teaching program for my nurses in pediatric care, because we've been hearing a lot about pediatric predilection, expected pediatric predilection in the third wave. I hope it never happens. But within 2 weeks, Dr. Tiwari got together a team along with Dr. Venkatesan, and today we have this program being rolled out. Thank you, the Department of Pediatrics, and the faculty. I know that Dr. Juma, Dr. Biswa have been in touch with me, as well as the College of Nursing. Thanks a lot, ma'am. I've just seen your sets and your stations, and you really work hard. I'd like to say this thing here. You've done such a very good job that maybe you could think of a gap analysis in applied nursing in the future, and probably roll out similar, especially communication, not just. And another thing that I'd like to tell you here, so said that the need for the program came from me. No, it did not. You see, trauma center nursing from the fledgling days of COVID, when it started with panic-stricken healthcare workers, has come a long way. The need actually came from the nurses. One of their representatives came up to me. One of the DNSs came up to me and suggested that we should have some kind of training for our nurses in case we face a pediatric wave. That in itself is testimony to the maturity and commitment of nursing in the trauma. I think you've all done a wonderful job in COVID, and I hope you continue to do so. I hope this program is truly enriching for all of you, and I hope you come back better prepared for the next wave, if there is one. Thank you.
Thank you, ma'am, for your encouraging words. Now I request Ms. Kamlesh Chandrelia, ma'am, CNO, AIIMS New Delhi, to say a few words.
Congratulations to the entire team for organizing pediatric nursing preparedness program. This program is planned with self-learning modules, videos, and practice of pediatric nursing procedures in the simulation lab, followed by preceptor guided practice in the pediatric clinical area. I welcome and thank our director, Dr. Dilip Guleria, for his patronage. I thank Professor Ashok Devary, who has been a pillar of support and consistent encouragement to make this training a success. I thank and appreciate Dr. Nirupma Madan and nursing administrator in JPNA TC for stepping forth and providing nursing staff for this training. And my heartfelt welcome and gratitude to Dr. Lata Venkatesan, Principal College of Nursing, for her interest, initiation, and collaboration in training our nursing personnel in COVID preparedness. I wish and hope that this training will address the need of our newly recruited nurses and answer their challenges faced by nursing administration in clinical areas. Hoping sincerely for a continuous relationship with College of Nursing in conducting such training in near future. All the best. Thank you.
Thank you, ma'am. A moment of gratitude makes a difference in your attitude. May I now invite Dr. Poonam Joshi, Associate Professor, College of Nursing, to propose the vote of thanks. Thank you, Honorable Speaker, Professor and Head of the Department of Pediatric Medicine, Dr. Nirupma Madan, dignitaries of the diet, nursing superintendent from Trauma Center, our Chief Nursing Officer, Mrs. Kamlesh Chandeliya, who is connected with us online, our facilitators for this workshop, dear participants, on behalf of College of Nursing and the entire organizing team from College of Nursing and Department of Pediatric Medicine, I take this opportunity to propose vote of thanks to one and all present in this function. First and foremost, I would like to express my gratitude to the Almighty God, the creator of all of us, for showing us this beautiful day and for the blessings which made this training successful. Then I would like to express my gratitude to Professor Randeep Guleria, our director, sir, for sparing your valuable time despite your busy schedule. Thank you, sir, for being with us. I would like to thank Professor Devary, sir. Sir has been a source of continuous support for us, both sir as well as our principal madam, Dr. Venkatesan. They have guided us. In fact, they are the ones who conceptualize this training program for our nursing officers, and they are all the time leading us. So my thanks to both of you. I would like to thank Dr. Nirupma, the additional MS Trauma Center, for her support and her entire efforts in making this program a grand success. Thank you, madam. I would like to express my gratitude to our Chief Nursing Officer, our nursing superintendents from Trauma Center, for their continuous support and providing us the list of participants at a very short notice, and as well as preparing the preceptors list from the clinical area. I would like to express my thanks to our resource persons from the Department of Pediatric Medicine, from Department of Nursing Services, from our college. They have taken a lot of trust and initiative in providing and preparing this learning resource materials in a very short period of time. My deep sense of appreciation to our dear participants for showing overwhelming response and being present with us today for attending this program. Thank you again. Without your presence, this program would not have been success. Last but not the least, I would like to express my thanks, special thanks to the facility team, Professor Amruj sir, Mr. Sharma, Prashant, Vikram, Bahar, everyone for providing logistic as well as the technical support. Thank you once again to all of you.